Welcome to this video on Presbycusis, commonly known as age-related hearing loss, as part of comprehensive medical surgical nursing. Let's start with a question. Which of the following best defines presbycusis? The answer is B, progressive bilateral sensorineural hearing loss associated with aging. Presbycusis is the gradual loss of hearing involving degeneration of the cochlear hair cells. Next question. Presbycusis typically affects which frequency range first? The correct answer is C, high frequency. Hair cells at the base of the cochlea, which respond to high-frequency sounds, degenerate first in presbycusis. What is the primary anatomical site of degeneration in presbycusis? The answer is C, organ of Corti/hair cells. Their degeneration is the primary pathophysiological change causing sensorineural hearing loss. A patient with presbycusis often complains that the answer is C. They can hear but have trouble understanding speech. This is because speech recognition requires high-frequency discrimination, which is compromised. Which diagnostic test is the gold standard for assessing presbycusis? The answer is B, pure tone audiometry. Audiometry quantitatively measures hearing sensitivity across various frequencies, confirming the characteristic sloping loss. Which nursing intervention is most appropriate for a patient with presbycusis? The answer is B, speak clearly at a low pitch, facing the patient. Lower frequency sounds are heard better, and facing the patient allows for lip reading and visual cues. Which factor is not a recognized risk factor for presbycusis? The correct answer is C, frequent ear canal cleaning. While wax impaction affects conduction, frequent cleaning does not cause the underlying sensorineural hair cell degeneration. Tinnitus is often associated with presbycusis. What is it? The correct answer is C, perception of ringing or buzzing noise in the ear. Tinnitus is a common symptom as the auditory system compensates for sensory input deprivation. Which medication class is highly ototoxic and may exacerbate presbycusis? The answer is B, aminoglycoside antibiotics. Medications like gentamicin are known ototoxic agents that damage hair cells, potentially speeding up hearing loss. What is the primary goal of using hearing aids in presbycusis? The answer is B, to amplify specific sound frequencies. Hearing aids amplify the high frequencies the patient can no longer hear to improve speech clarity. What type of hearing loss does the Rinne test show in presbycusis? The correct answer is B, air conduction greater than bone conduction. Presbycusis is sensorineural loss, meaning the normal pattern holds, but overall hearing is decreased. Which is a sign of social withdrawal due to presbycusis? The answer is C, reluctance to attend social gatherings. Difficulty understanding speech in groups leads to frustration and social avoidance. What does the term phonemic regression imply in presbycusis? The answer is B, difficulty in discriminating speech sounds even with amplification. The brain struggles to correctly process and interpret the phonemes. Which environment is most challenging for a presbycusis patient? The answer is B, a restaurant with background music. Background noise masks speech, and patients struggle to filter these competing sounds in complex environments. What is the role of the nurse in managing presbycusis? The correct answer is B, facilitating access to audiology and support services. Nurses coordinate care, educate the patient and family, and help patients navigate resources like audiologists for hearing aids. When is a cochlear implant considered for presbycusis? The answer is B, when hearing aids provide minimal benefit. Cochlear implants are reserved for profound hearing loss when standard amplification cannot facilitate functional communication. How does age affect the ossicles in the middle ear? The answer is B, osteoarthritis can affect joint mobility. While presbycusis is inner ear-based, age-related changes like arthritis in the ossicular joints can sometimes contribute to hearing impairment. Which of these is a major barrier to using hearing aids? The answer is A, high cost and stigma. Many elderly patients resist hearing aids due to the perceived stigma and the significant financial expense of quality devices. Presbycusis is considered what type of degenerative disease? The answer is C, slowly progressive degenerative process. It is a hallmark of aging where biological structures like hair cells degrade over decades. Which letter of the alphabet is hardest to hear for presbycusis patients? The answer is C, S. The S is a high-frequency consonant, and high-frequency consonants are crucial for speech discrimination, which are lost early in presbycusis. Why should a nurse be patient with a presbycusis patient? The answer is A, they have hearing loss and might need more time to process. Providing extra time is key for compassionate and effective nursing communication. What is the benefit of auditory training? The answer is B, helps the brain adapt to new hearing cues. Auditory training helps the patient relearn how to interpret sounds heard through hearing aids, increasing the success rate of the device.